When you come in to see me for evaluation of your upper eyelid, we really need to look at three things. We need to look at the position of the eyebrow, how much skin and fat is on the upper eyelid, and the third thing we look at is the position of the lash line and its relationship to the pupil or the line of sight. All three of those things can impact the weight of the upper eyelid as well as your peripheral vision and how much you see. In order to evaluate the upper eyelid, we'll first look at the position of the eyebrow. A male eyebrow position should be relatively flat at the eye socket rim or the bone right above the eye. A female eyebrow should be arched at the lateral 2/3 of the brow and approximately 1 centimeter above the eye socket rim. If you think about a brow like a curtain rod, that curtain rod is responsible for holding up the curtains. If the curtain rod starts to sag, the curtains hit the floor, and we need to both fix the curtain rod as well as the position of the curtains. When we evaluate the upper eyelid skin, the eyelid skin can be fine and crepey and overhang the eyelash edge, which again can add to the weight of the upper eyelid as well as decrease the peripheral vision. Removing that upper eyelid skin is called a blepharoplasty. That's a surgical operation where we make an incision in the natural crease of the upper eyelid and remove the eyelid skin as well as fat from the upper eyelid to improve the position of the skin as well as the aesthetic appearance of the eyelid. We also evaluate the position of the eyelash line. If the position of the eyelash line is low, that's called ptosis, P-T-O-S-I-S. We may consider a surgical operation done through an incision in the natural crease of the upper eyelid or from underneath the upper eyelid to elevate the position of the eyelash line. Both of those operations are intended to improve the peripheral vision and open the eye or the aperture of the eye. There are several options for us to consider elevating the eyebrow. We can do that through incision lines both in the natural crease of the upper eyelid. I consider that more like a brow stabilizer. We call that an internal brow pexy. We go through an incision in the natural crease of the upper eyelid, often used for blepharoplasty surgery. We tunnel underneath and elevate the subbrow fat pad in the lateral 2/3 of the brow to elevate the position of the brow or stabilize the position of the brow to prevent us from pulling the eyelid or eyebrow down at the time of eyelid surgery. A second option for eyebrow lifting is to make an incision across the lateral 2/3 of the upper above the eyebrow. So an incision line in the lateral 2/3 of the eyebrow just above the brow hairs. That allows us to excise a section of skin and subcutaneous tissue to elevate the brow in that region. That surgery is best done for patients that have a wrinkle line or rhytid above their eyebrow that we can hide the incision line in, or that have fuller eyebrow hair to camouflage the incision line. We can also make incision lines in front of the hairline or behind the hairline. Those surgeries are more considered a forehead lifting option to elevate the entire eyebrow and forehead to smooth the forehead as well as improve the brow position. Those surgeries are longer in length and require a longer recovery period, but give us a nice elevation of both the brow and forehead.